Today's topic is aneurysms. To start off, we need to know what an aneurysm actually is. So, what is it? An aneurysm is any part of the artery that has become weakened. This causes ballooning or widening of the artery. The bigger the bubble, the more susceptible it is to popping. Think of a balloon. When you have a full balloon and squeeze it, part of that rubber will expand, causing a bump. This bump is considerably more thin than the rest of it. As we increase the pressure, the air goes to the place of least resistance. This causes the bump to grow further and further until it pops. Now that we know what the condition is, who's the most at risk? Like anything else, if you have a family history or are geriatric, which is the older people, you are at a higher risk. Cardiovascular problems like hypertension, high blood pressure, hyperlipidemia, aka high cholesterol, which means lots of fats or lipids in the blood, and atherosclerosis, which is the buildup of fats on the arterial walls. Genetic and congenital diseases like Marfan and Ehlers-Danlos syndrome weaken the connective tissues. This puts you at a disadvantage because your arteries are already weakened. Other factors include injury, infection, and smoking. Aneurysms can pop up all over, such as the brain, which is a intracranial aneurysm, aorta, popliteal, which is behind the knee, mesenteric, and splenic are the most common places. For the purpose of this video, however, we'll just be talking about the aorta since it's the most common type. First of all, let's talk about the aorta itself. It is the main artery leading from the heart and supplying oxygenated blood throughout the body. It is the largest artery in the body and is located in the center of the body just in front of your spine. You might be able to feel its pulse if you press down hard enough on your navel. This is because the aorta spans two major body cavities, that is the thoracic and abdominal cavity, before it begins to split off and go down both legs. Starting from the heart, the thoracic region houses the aortic root, ascending aorta, aortic arch, and descending aorta. The abdominal region only houses one, which is the abdominal aorta. Now that we got the anatomy out of the way, let's move on to our topic. If you have an aortic aneurysm, it is possible that you won't even know it's there. Many people die because their aorta will rupture and they didn't even have a clue that something was wrong with them. However, if you aren't asymptomatic, you'll likely feel pain around the affected area, and if it's big enough in the abdomen, you'll actually be able to see a pulsating mass from the ballooning of the artery pushing up against the intestines and skin. If you feel any of these symptoms, the doctor may order imaging tests in order to find out the problem. Typical tests include computerized tomography scan, CT scan, magnetic resonance image, MRI, and/or an ultrasound. All of these techniques allow the physician or radiologist to view the location and size of the aneurysm, which is necessary for the treatment options. A small aneurysm is less than 5 centimeters, and if it isn't growing fast, you might just be monitored. You'll have to come back to the office to get tests every 6 months. Or they may give you medicines like beta blockers, which will help lower blood pressure, or calcium channel blockers, which lowers the blood pressure but also relaxes the artery. However, if an aneurysm reaches 5 to 5.5 centimeters or is growing at a rate of more than half a centimeter every 6 months, it is considered at a high risk of rupture. At this point, surgery is your best option. This can be achieved two ways. One is open surgery and the other is endovascular surgery. In an open surgery, the chest or abdomen is opened up. The aneurysm is removed and a graft is put in place to allow the blood to flow through the aorta normally. In an endovascular surgery, the surgeon uses catheters and a graft is guided up through the vessels up to the place of the aneurysm. Unlike the open surgery, the aneurysm is left in, but the graft takes over the function. So the aneurysm is relieved of the stress and is able to stay in. The major difference between these two surgeries is that in endovascular surgery, it is considered a minimally invasive surgery. That means that less damage is done to you, giving you less pain and a quicker recovery. don't get any treatment and we allow this to run its course. First, you may experience an aortic dissection. This can be the cause or the result of the aneurysm. It could be a small tear, but with blood constantly pushing up against it, the tear can grow. This will weaken the wall and cause further ballooning. After that comes the aortic rupture. This is an extremely fatal condition. Only about 90% of the people who experience this end up surviving. Here, the aorta finally gives and the walls begin to tear and burst into the body cavity. Blood will begin to rush out at a maximum rate of 5 liters per minute. Considering that the average human only has 5.5 liters of blood, that is not a rate to be messed with. Once your aorta ruptures, you'll feel an intense tearing pain, and you'll begin to experience symptoms of hypovolemic shock. Hypovolemic shock is when the volume of blood is too low. This will result in hypotension, which is from the lack of blood being able to push around the body, clamminess, nausea, vomiting, and a rapid pulse. The body is trying to compensate for the low blood pressure by increasing the heart rate. However, without immediate action, the compensation will fail, and the person will fall into decompensated shock, which will be followed by death. This somewhat silent killer will claim 13,000 lives annually in the United States. White men between the ages of 55 and 65 are the most at risk, and that risk will begin to double every decade after that. In conclusion, any aneurysm can be dangerous, so if you are at high risk, go get checked out. You wouldn't want to bleed out. Trust me. That's all for this episode. I hope you all enjoyed. So this is kind of a pilot episode for me. Things may change in the future, and as always, feel free to suggest any changes or errors. All my sources will be posted down in the subscription, and until next time, I'm the Seed Central, signing off.